All right, it is a little bit after 1 o'clock, so we can get started now. Welcome back. Seminar presented by the Harvard Center for Population Development Studies. Today's seminar is sponsored by the Department of Global Health and Population here at the School of Public Health. Just a couple of notes to get started. The speaker will have around 40 minutes for their presentations, followed by a Q&A session. We will take clarifying questions throughout the presentation, but we have that you hold all other questions for the Q&A session. We'll wrap up around 2:15, but if you do need to leave early for meetings, that's okay. Now, thank you, today's speaker.
Thank you. Good afternoon, everyone. We are very thrilled and fortunate today to have Emma Zang, visiting professor of Sociology and Biostatistics at Yale. Emma's research lies at the intersection of health and aging, marriage and family, and inequality. Especially Emma's work aims to improve our understanding of how early life conditions affect later life health outcomes, and also the impact of inequality on household members' health and well-being. At the same time, Emma is developing and evaluating methods to model trajectories and the life transition to better understand how demographic and inequality shape health and well-being of individuals. Emma's work has appeared in a wide range of journals in sociology and public health, including American Journal of Sociology, Demography, Social Medicine, Sociological Science, Social Research, and the International Journal. Thank you very much for joining us today.
Thank you so much for the kind introduction, Zang, and thank you for the organization. I'm really glad to be here today to share the findings of one of my latest work. This is joint work with two of my amazing PhD students, Kitaro Okura and Yushi, and we welcome for any feedback. In the United States, anti-abortion laws have been increasingly popular at the state level, especially in these Republican-led and conservative states. States have enacted 1,313 abortion restrictions since Roe v. Wade was decided in 1973, almost half of them since the beginning of 2011. And last summer, as we all know, that the Supreme Court even overturned Roe v. Wade, ending the right to abortion upheld for decades. Although the Guttmacher Institute thought that 2021 was the worst year for abortion rights in almost half a century, but I think we can all agree it's only getting worse in some sense. So sex-selective abortion bans are a special type of anti-abortion bans that have been increasingly popular in the past 2 decades. So sex-selective abortion bans is very simple. It prohibits abortions on the basis of the sex of the fetus, particularly girls. The popularity of such bans in the States in the past 2 decades is really, really weird because the practice of sex selection is typically not considered a problem in the United States. Maybe it could be a problem in Asian countries or in some other developing countries, but people have rarely heard about sex-selective abortion. It's a huge problem here in this country. The advocates of sex-selective abortion bans, they argue that Asian immigrants disproportionately abort female babies in this country because of a cultural preference for sons. So the such bans, they extensively pointed to one study conducted by Columbia economists in 2008, which drew on the 2000 census data and found that sex ratio is biased occurring among immigrant Chinese, Indian, and Korean families if there was no previous son. So to be more specific, they look at parity-specific sex ratio. So they did not find sex ratio bias among first births. They found somewhat sex ratio bias among second births, but they found relatively more biased sex ratio among third births. But to be fair, the sample size of the third births in their sample is only a little bit more than 300. Okay, so later studies, especially by economists and legal scholars, they pointed out that the interpretation of their findings can be misleading. For example, some work has looked at the more recent data in 2007 and 2011, and they found that if we don't look at parity-specific sex ratio, if we look at all births together, the proportions of girls are actually higher among immigrant Chinese, Indian, and Korean families compared to whites. And legal scholars have also argued that sex ratio bias is not necessarily proof of sex selection practices. If someone really wants to select the sex of the fetus, there are actually safer and easier way to do so at the early stage. And also, some other people have pointed out that so some preference is not culturally unique in Asian culture. So for example, according to a Gallup poll conducted in 2011, when asked if they can only have one child, American men prefer the boy over a girl by a margin of 49 to 22%, whereas American women express no preference. So we criticizing Asian culture to be male biased blinds the reality that some preference is not uncommon in all patriarchal societies, including the United States. So at a minimum, it is overreach to say sex-selective abortion practice is a huge problem among immigrant Asian population in the States, and sex-selective abortion bans a sensible and effective policy solution. Therefore, the legal scholars have argued that sex-selective abortion bans in the United States is a solution in search for a problem. Okay, so this map shows the prevalence of sex-selective abortion bans. Such bans initially were passed in Illinois and Pennsylvania in the 1980s. At that time, they didn't point to anything related to Asian immigrants. And no states have followed their effort in the past decade. However, starting in 2009, 12 states started to enact sex-selective abortion bans. So the dark blue states on the map indicate those 12 states who already enacted such bans. And many other states attempted or are currently trying to do the same. So the medium blue states on the map indicate those states who are trying to pass such bans. The question is, like, why is the resurgence right now? So in part, this reflects a broader effort of anti-abortion across the nation. However, the specific pursuit of sex-selective abortion bans also reflects a nativist response to the dramatically changing demographics in many conservative southern and Midwestern states. So these states, such as South Dakota, North Dakota, North Carolina, and Oklahoma, they have seen the fastest growth in the immigrant Hispanic Asian population in the past 2 decades. And if we talk about absolute number across California and New York, still have the largest Asian immigrant population. But if we look at the growth rate, these conservative states, they actually have the fastest growth rate. And from the so-called psychology literature, we know that relative increases matter more for the perception of threat. Indeed, there have been increasingly backlashes against these dramatic demographic shifts, especially at the state level in these conservative states. Since 2007, state legislatures in the United States have annually proposed over 1,300 immigration-related bills and resolutions, and most of these policies were passed in these conservative states. So the proponents of such bans, they tap into the anxiety, into the influx of the foreign outsiders coming to the state, and they try to frame this question as a sex discrimination question. So for example, Don Hager, who is a South Dakota state representative, he said the following in public related to the passage of the ban. Let me tell you, our population in South Dakota is a lot more diverse than it ever was. There are cultures that look at a sex selection abortion as being culturally okay. And I will suggest to you that we are embracing individuals from some of those cultures in this country and in this state. And I think that's a good thing that we invite them to come. But I think it's also important that we send a message that this is a state that values life, regardless of its sex. So another South Dakota state representative, Stacey Nelson, said the following: "Many of you know I spent 18 years in Asia, and sadly, I can tell you that the rest of the world does not value the lives of women as much as it values the lives of my daughters." So as you can see that these conservatives, they try to use Asian immigrants as a convenient foil to promote their pro-life agenda. And they are kind of smart in the way that they are able to turn the tables of pro-choice criticism, which is the denial of women's rights, into pro-life advocates. So how about empirical evidence? So there have been a lot of discussions in the legal community, but there haven't been a lot of empirical evidence examining the consequences of such bans. The only empirical study we're aware of is conducted by Nandy et al. 2014. They examined the consequences of sex-selective abortion bans passed in Illinois and Pennsylvania in the 1980s, and they found there's no effect on Asian infant sex ratios. However, such bans at that time did not invoke any harmful stereotype against Asian immigrants. And as we're a public health seminar, we all wonder, what about potential population health consequences? And social scientists have argued that population health is not only determined by medical care, but also is shaped by various social factors known as the social determinants of health. And social policies are an important category of social determinants of health. So living in the state with anti-immigrant policies may harm immigrants' health through material or resource deprivation and symbolic exclusion. So symbolic exclusion may just simply be a message sending to immigrants that you are not welcome here and you are not liked. And pregnant women and their infants in utero have particularly vulnerable to negative social climates, even when there is little impact on material or resource scarcity. So I think there have been an increasing literature, but still, when we talk about the number of studies, I think there are probably less than 5 studies, but we do have some evidence. For example, some scholars have examined the consequences of Arizona's SB 1070 immigration bills and documented their negative effects on Latina immigrants' birth outcomes, such as low birth weight and preterm births. But importantly, they have found that these bills actually did not increase the rate of deportation or detentions. So suggesting the main mechanism is actually symbolic exclusion and increasing maternal stress. And we have a really interesting case here because sex-selective abortion bans, they are backlashes against immigrants. And they also invoke harmful stereotypes against Asian immigrants. And they also try to restrict women's reproductive rights. So it's actually policies rooted in xenophobia, structural racism, and structural sexism. So it's like a very interesting combination, although it's a very sad combination. So theoretically, sex-selective abortion bans may harm Asian immigrants' birth outcomes. And if we think about the mechanism, like how it could actually harm Asian immigrants' birth outcomes, let's think about the immigration processes in the United States. So immigration in the States is highly racialized, and different immigrant groups suffer from specific stereotypes. So for example, in the context of Asian immigrants in America, they were considered both model minority and perpetual foreigners. They're considered a model minority because Asian immigrants as a group, on average, have higher socioeconomic status compared to whites. But they're also considered perpetual foreigners because Asian immigrants were also perceived as being unassimilable, often leading to questioning of their loyalty to the United States. So because of this, I think the material or resource separation may not be as pricing as a mechanism because they are relatively higher socioeconomic status. But stress and symbolic exclusion may be especially relevant because of their experience of being excluded and unaccepted. And this effect may be particularly more pronounced among highly educated group or high SES groups because these people, they typically hold high income jobs, and these jobs require them to interact more with whites and non-immigrants, which could make their racial identity more salient. So it's very likely that high SES Asian immigrants are actually more affected through the mechanism of symbolic exclusion. So we argue in this paper that sex-selective abortion bans harmed birth outcomes of Asian immigrant mothers by increasing the salience of harmful racial stereotypes and reinforcing a hostile social climate that is unwelcoming of Asian immigrants. Specifically, our first hypothesis is such bans increase the probabilities of low birth weight and preterm births. And we also hypothesize sex-selective abortion bans have no effects on sex ratio of infants born to Asian immigrant mothers. Because first of all, we don't have very good evidence of the practice of sex selection is actually very prevalent in this group to begin with. And even if they really have some preference and they really want to select the sex of the infants, they could also try other like easier ways earlier at the earlier stage of the pregnancy rather than relying on sex-selective abortion bans. So therefore, we hypothesize we probably won't see any effects on the sex ratio. So we use data from the 2005 to 2019 natality birth data from the National Vital Statistics System. And this data has information on all registered US births. And we choose 2005 as a starting year because it is up to 5 years before the passage of the first sex-selective abortion bans invoking harmful stereotypes against Asian immigrants. And we obtain restricted data about immigrant mothers, countries of origin, and states of residence. We restrict our sample to singleton births given by foreign-born mothers, and we also excluded missing cases in outcomes, but treated missing observations in covariates as a separate category to maintain a big sample size, also to avoid selection. So our final sample has more than 12 million births for all birth outcomes. So we have three dependent variables. The first is low birth weight measured as lighter than 2,500 grams, and preterm birth measured as gestational age shorter than 37 weeks of pregnancy. And we also use infant sex, which is measured by the probability of having a male infant to capture sex ratio. And we consider the following covariates: birth months, paternal risk, ethnicity, infant sex, maternal and paternal educational attainment, mother's age, father's age, mother's marital status, live birth order, and number of prenatal visits. Okay, for the empirical strategy, we adopted a triple difference strategy. So intuitively speaking, we consider three differences. The first difference is between states with the ban and without the ban. So the states with the ban is our treatment, is part of the treatment group, and the states without the ban are the control group. And then we also consider the difference before passing the ban and after passing the ban. So the third difference is actually between Asian immigrants and all other immigrants. So here has a map. So this map shows the prevalence. So specifically, we did not consider Illinois and Pennsylvania because these two states passed the ban too early. It's not in our study period as well. And also they didn't invoke xenophobic stereotypes against Asian immigrants. And we also didn't include Tennessee and Mississippi because they passed the ban in 2020, which we don't have data for. And we also excluded in Indiana, Kentucky, and Arkansas because they blocked the ban right after the ban was passed. So people may not be aware of the ban, or people may think the ban didn't pass at all. So our model specification look like this. I'm happy to come back to this if people have specific questions, but very quickly. So Asian is a dummy variable capturing whether this person is Asian immigrant versus other immigrant, and sex-selective abortion ban is a time varying variable indicating what if a sex-selective abortion ban was enacted in state S and year T. And specifically, we included 3 interaction terms, trying to really get into the endogeneity of the issue. So the first interaction terms is between year dummies and state dummies. So this interaction term theoretically will remove differential time trends of the outcome for different states. So for example, if there are different time trends in the birth outcome, so examine due to differential proportions of Asian immigrants across different states in each year, and then this should take care of it. And then if there are different time trends due to annual unemployment rates across states, and then this should also kind of handle that. And then the second interaction terms we include is being Asian and state dummies. So this should allow the effects of being an Asian immigrant to vary across different states. So for example, that would help us account for effects due to selective migration to each state among Asian immigrants. So a question is like, who are the Asian immigrants who like to live in these conservative states, right? So they might be very different from Asian immigrants who like to live in California. And then the third interaction terms is being Asian and a year dummy. So this would allow us to, would allow the effects of being an Asian immigrant to vary over time. So this would help account for effects due to an increasing or decreasing trend of anti-Asian sentiment in all states over time. As we know that, for example, before the COVID, actually captured by some survey data, the anti-Asian sentiment has been decreasing over time. So this interaction term will be capture that kind of trends. Okay, so we also look at the dynamic effects by replacing the sex-selective abortion ban dummy using a categorical variable with the following categories: not enacted, 0 to 2 years after enacted, and more than 2 years after enacted. So we want to look at the dynamic effects because people may not respond to the policy immediately. We actually use dynamic, like the event history type of analysis before, but then we decided like 2 years is actually a substantively meaningful cutoff. So we, for the simplicity, we just present the results here using this model specification for the dynamic effects. Okay, so before showing you the results of the triple difference, I want to show you some descriptive trends. And only the descriptive trends are already very striking. So this figure shows the prevalence of low birth weight over time by immigrant group. As we can see that for Hispanic, white, and Black immigrant, so there are 2 groups. One is our in the states where sex-selective abortion ban was enacted. The other is our control group. Basically, those are the states without the ban. And then we can see that for everybody except for Asian immigrants, the 2 trends are literally indistinguishable or parallel over time. We don't say like a diverging trend between the 2 groups. But if you look at the Asian immigrants, actually we see between the 2 groups have been increasing, especially since 2013. The timing coincides with the passage of the ban in most states. If you look at the prevalence of low birth weight by non-immigrant groups, again, we don't see this increasing gap between the 2 groups. And if you look at the prevalence of preterm births over time, the same idea here. So for the other immigrant groups, we say the trends are relatively parallel, but only for Asian immigrants, we see the gap between the 2 groups actually becoming larger, especially around like 2013. Again, if you look at the non-immigrant group, we don't see any diverging trends between the 2 groups. So this descriptive trend suggests there must be something going on about like Asian immigrants. That's from the triple difference model. So panel A is from our main specification. Basically, we're comparing Asian immigrants using the reference of all other immigrants. And we say that consistent with our hypothesis, we saw that sex-selective abortion ban increased the probability of low birth weight by 0.3 percentage point and increase the probability of preterm birth by about 0.5 percentage point, and it does not have a significant effect on infant sex ratio. And then as a robustness check, we also switched the reference group from all other immigrants to white immigrant mothers. And we see the results, the patterns are more or less consistent, except that so the significance is like borderline for low birth weight. And then if we switch the reference group again to white American mothers, and we see the patterns are more or less consistent, except that now I feel the infant sex ratio is like across the p-value of 0.1. So we can say that in general, we have pretty good evidence that sex-selective abortion bans increase the probability of preterm birth and low birth weight, but I don't think we have good evidence that it actually changed sex ratio. And this exercise is to give us more confidence because by changing reference groups, we're kind of like removing different like trends. Okay, so now let's look at the dynamic effects. We see that there are basically no effects in the first 2 years after the ban was passed, but the effects really start to kick in after 2 years. Okay, so we keep seeing that we hypothesize the main mechanism is symbolic exclusion rather than material or resource separation. But do we have evidence for that? Unfortunately, our data does not allow us to explore this fully, but we do try our best to provide some preliminary evidence. So this figure used the immigrant policy index. So this index was made by a group of public health scholars at Columbia University. So a positive value indicates more inclusive social climate towards immigrants. And then the bottom line here is our treatment group, and the upper line there is our control group. As we can see that in general, I mean, our treatment group have definitely more conservative, so they has a less inclusive social climate against immigrants. But over time, we see the gap between the two groups increased, and also around the year 2013-ish. So I wouldn't say this is like wonderful, perfect evidence supporting our hypothesis, because this is not specifically about Asian immigrant, but it's about all immigrants. But I think that we can definitely observe something going on in these states. Okay, so another thing we did is we tried to see whether material or resource separation can be a mechanism. So we look at whether sex-selective abortion bans affected the utilization of prenatal care services among Asian immigrants. And we look at the three outcomes: the inadequate utilization of prenatal care services measured by the number of prenatal visits smaller or equal than 5 times, whether started prenatal care in the first 2 trimesters, and whether used prenatal care. Basically, we didn't find anything. Our results do not support the possibility that sex-selective abortion bans actually affected prenatal care services among Asian immigrants. And then sex-selective abortion bans may also increase physicians' likelihood of engaging in profiling and integrating Asian immigrants about their reasons for seeking an abortion. So this may go into 2 ways. First, this may increase stress among Asian immigrant women when they are questioned by the physicians. The second, so Asian women, immigrant women who wanted to get abortion, now they may be less likely to seek abortions and instead decide to carry out unwanted pregnancies. So therefore, we may observe like lower birth weight or more preterm births. And we also examine this possibility, but our results find nothing to support this possibility as well. Okay, so now let's look at heterogeneous effects. So we hypothesize that, well, if the mechanism is really symbolic exclusion, then the effects may be more pronounced among highly educated or high SES Asian immigrants. And we therefore conducted subgroup analysis by educational attainment of the mothers. And indeed, we find that the effects are greater among mothers with at least bachelor's degree, suggesting that the mechanism is indeed more likely to be symbolic exclusion rather than material or resource deprivation. We also look at the heterogeneous effects by infant sex. We didn't find any meaningful differences for male and female fetuses. We also look at the country of origin. So the idea is that because the narrative, promoting sex-selective abortion bans, specifically targeting immigrants from China, India, South Korea, and North Korea. So if the mechanism is really the narrative and symbolic exclusion, we should say the effects are more pronounced in this group. And indeed, we find that the results are indeed more pronounced among immigrant mothers from China, India, South Korea, and North Korea. Actually, if you look at the mothers from all the other countries, Asian mothers from all the other countries, we don't see any significant effects here. We did so many robustness checks, so I'm happy to talk about those later on. But I want to highlight one robustness check that we did. We also examined the effects of the sex-selective abortion bans among other racial ethnic minority groups, including Black immigrants and white immigrants and Hispanic immigrants, and non-immigrant groups, including white Americans, Black Americans, and Hispanic Americans. We didn't find anything in any of this group, suggesting that the effect is particularly unique among Asian immigrants. So it's not a story about being Asian alone. It's not a story about being immigrant alone. It's really the intersectionality between being Asian and being an immigrant. To conclude, so the rapid increase in Asian immigrants have been accompanied by the rise of anti-Asian and anti-immigrant sentiments. And conservatives have taken advantage of this backlash to exploit Asian immigrants as a convenient foil to advance an anti-abortion agenda. And sex-selective abortion bans are justified by playing on harmful racial stereotypes about Asian immigrants and their cultural preference for sons. And we found in this study that sex-selective abortion bans have had a negative effect on the infant birth outcomes of Asian immigrants, including increasing the probability of low birth weight and preterm births. But we don't have good evidence that such bans affected a sex ratio. There's some limitations. One is, although we try to really deal with endogeneity by using a triple difference, so triple difference is more robust than the traditional differences estimator, because even if the traditional differences estimator is biased, as long as the two DID estimators are biased in the same way, the triple difference can remove the bias. So if you think about it, so basically we look at the DID estimator among Asian immigrants, we look at the DID among other immigrants, and then we take the difference of this DID estimator, right? So that will remove all the kind of the same bias for these two DID estimators. But still, all of those factors may still confound our results. Only like randomized trial could have probably solved this problem perfectly. And then second, data limitations do not allow direct testing, do not allow us to directly testing the mechanisms. So we're just providing some evidence here, but we didn't really thoroughly testing the mechanisms. And then some states in our sample enacted sex-selective abortion bans quite recently. So our latest data is in 2019, so we were not able to examine those states. The contributions of our study. So first, we focus on Asian immigrant mothers whose health outcomes remain understudied in population health research or in social science in general. So this is a very important oversight because Asian immigrants or Asians are projected to be the largest immigrant group by mid-century in the United States. So we definitely need to understand this group more. And the results of this study can significantly raise public awareness of the largely unnoticed existence of structural level anti-Asian racism in present-day American society. So why Asian immigrants' health outcomes have been understudied? There are multiple reasons, right? So data limitation is one, but I don't think it's a very important one because people can always collect more data. I think it's related to Asian immigrants being the model minority, because a lot of people think Asian immigrants, they already have high socioeconomic status, so they don't need help. So they are the invisible group in social science research. Actually, my students and I also conducted a literature search in top sociology journals, and in the past 20 years, we didn't find even one study looking at Asian immigrant health outcomes. And then the second contribution is the results of this study is part of the emerging literature, which highlight how adverse health consequences may be driven by a toxic social climate that deepens the stigma of vulnerable groups, even when there is little material impact on the targeted group. This is in contrast to most existing empirical studies on the health of other marginalized groups, which tend to underscore material or resource scarcity, such as incarceration or deportation, this kind of mechanisms. And then third, our investigation is of timely public policy interest, given the rapid expansion of abortion restrictions and the Supreme Court decision in the summer of 2022 overturning Roe v. Wade. And finally, our investigation is also at a time where there has been a dramatic rise in anti-Asian hate crimes. So actually between 2020 and 2021, the prevalence of anti-Asian hate crimes have increased by 300% in the United States. So especially during the pandemic, there has been even more increases. I mean, it's largely driven by the anti-Asian, anti-immigrant sentiment during the pandemic. So these kind of sentiments will likely adversely affect Asian immigrants' health outcomes during the pandemic, and we will need more studies on that. Thank you.
We'll now start the Q&A. For anyone on Zoom, if you'd like to ask a question, you can use the chat feature or raise your hand, and we'll do our best to get to you.
Many questions. Maybe David can start.
So two questions. So one is just a technical thing. You're using a triple difference, but another approach is the sort of synthetic cohort approach to get a matched control. I just wonder if you would discuss that. But I think that's a pretty technical thing. I think a more substantive point is essentially what you're trying to do here is a step function response. Is that essentially there's no effect of these bands when they come in? There's a step function response in your outcome.
Right.
But the story you're telling that it's about a general social condition would suggest to me it's not really a sort of a step function response to a particular law. It's not the law itself is changing when medical providers are acting. It's a general climate which would suggest a more continuous response. And the other issue is you didn't really talk about how you control for the general climate towards Asian immigrants. And it could be that these specific laws are just examples of a broader change in the environment. And I think sort of controlling adequately for that. So I think really, there's a question to me: are you really trying to identify the effect of these specific bans or a general change in the climate? And I think the method is very much about this specific ban, but I think the story is about a general climate.
Thank you, David. It's a hard question, but it's a very good one. So I do have some thoughts. For the first question about synthetic cohort, I think that maybe the traditional original synthetic cohort method applies to the case when the number of treatment units is kind of limited. In our case, we actually have many states in the treatment group. So I am not sure the advantage of doing synthetic cohort here compared to the triple different approach we are doing now. And then second, so that's actually the hard question. So we are trying to really identify the causal effect of such bans. So we agree with you that if you look at, there's like an increase in anti-Asian social climate for sure. And I think that definitely contributed to low birth weight and preterm births, as we saw in the descriptive figure. But we think based on our results, On top of that, this bans also helped to make this worse. So in other words, we think these bans have independent effects on the birth outcomes, but we also agree that the general social climate also increased the probability of birth rate, low birth rate of preterm birth. So we actually did some robustness check. So the triple difference, because we have an interaction term between being Asian and the dummy years, right? So that would remove the time trends of anti-Asian sentiment happening in all states. So that would help address some of that. But the question is really whether the anti-Asian sentiment change over time differently between the treatment and the control group, right? So one thing we did is that we actually further break down the treatment group. So some treatment group, they have many other abortion bans going on around the time of the sex-selective abortion bans. And they also have many other anti-immigrant bills at the same time. But there are 2 states which they don't have any other bans going on around the same time. So we only use that 2 states as our treatment, and we still find an effect. So, I mean, to be fair, the effect sizes here we look at is not particularly huge. It's like, you know, if you look at the main results, it's only 0.3% percentage point and 0.5 percentage point. But this effect size is actually comparable to the study examining Arizona's 1070 immigration bills on Latina mothers' birth outcomes. But thank you. Yes.
Whenever I think about birth weight, one of the strongest effects on birth weight is the age of the mother.
Mm-hmm.
I wonder if there's any data on whether there are differences in ages of the mother of Asian group versus other groups.
That's a great question. So we did look at subgroup analysis by maternal age. We didn't find any meaningful results there. Yes.
I had a question about the environment more generally here, insofar as like, do you think these bans are signaling to Asian mothers that the environment is more hostile? Is it migration response? Are people leaving their states that are less fun?
Mm-hmm. That's a great question. We looked at the proportion of Asian immigrants in the treatment and control groups over time. And we didn't see a dramatic reduction in the proportions of Asian immigrants in conservative states. But maybe later on, you know, if this continues to happen, we will see a reduction. But in our study period, we haven't observed anything. Yes.
So my question also relates to the mechanism of, you know, you see those sort of lower outcomes. You mentioned that you had a number of prenatal care visits.
Mm-hmm.
Maybe I missed this, but was there any difference in number of prenatal care differences among the different groups? That's one thing.
Mm-hmm.
The other, again, thinking of the mechanisms, if this is more discrimination against Asians,
Mm-hmm.
Then the story becomes similar to African Americans, where even if you go to the prenatal care visits, the treatment you receive is different.
Mm-hmm.
During delivery, you can have a different treatment. That there's literature on this, maybe not in Asians, but there's in Americans. So, I think part of my question, behind what David said, is to me it's not clear what is the mechanism. If it's more discrimination, then, you know, maybe the policies are, you know, the story behind the policies become Asian just because you have a higher volume. So I don't know if you also look at what's the number of Asians in each one of those, by state or county.
Right.
So I'm still puzzled about what is the mechanism creating. And you had at least one variable that says nothing about the quality of the prenatal care visit, but I'm curious if you have.
Yes, I agree that our exploration of mechanisms is limited because of the data limitation. So we do control for a number of prenatal visits in the model, so that shouldn't be a confounder. And we also examined whether sex-selective abortion bans affected Asian immigrants' prenatal care services. And I agree with you, we don't have any variables capturing the quality of the care. So that's unfortunate. But in terms of a number of visits, actually we actually found like sex-selective abortion bans slightly increase the number of prenatal visits among Asian immigrants in the treated states. So this could mean a lot of things. Maybe they're more stressed, so they need to see the doctor more. But in any case, it's not the indication of they're underusing prenatal care services. Yeah, so I think that's a good point. We should probably add in the limitation that we don't really have data on the quality of the prenatal services. So we cannot completely rule out the mechanism of material or resource scarcity.
And if I may add another.
Yeah.
Do you control for first generation, second generation?
No, this is only first generation foreign born.
First
Yeah, foreign born Asian immigrant mothers. Yeah, so.
Yeah, so, yeah, I may have missed this, we may have done this, about these tracks, I was wondering. I know in one of the models, you try to control, you try to see the effect of lags to see the effect cumulatively over time.
Right.
And we try to include also the leads to see whether the effect actually kicks in even before the balance that will capture extents.
Yeah, I think that also speaks to David's question. We did do that. So we did a robustly check, placebo test. So basically we pretend the ban actually happened 2 years before its actual happening date. We didn't find anything. So basically there's no effects in the kick-in period before the ban was passed. So I think the reason is that there are so many bans being proposed every day in different states. And people even know such bans were proposed, they may not take it very seriously until the ban was actually passed. So that's why I think that even there have been discussions even before the ban was officially passed, but people may not take it very seriously. Yes.
So I know culturally reporters are there anything about order?
Yeah, great question. We did look at subgroup analysis by birth order. We didn't find any significant differences between different birth orders. Thank you. Yes.
Talk. How do you control for just other more general abortion bans? It seems like the states that you're seeing socially different are more conservative states that might have more, maybe more rural hospitals or more religiously affiliated hospitals. Even without bans, you might be getting less availability for women's fertility. I guess how do you know that? I guess you were showing a difference in 2013 when these bans were taking place. Do you do any control for other bans that were taking place around the same time, or even just social stigma of abortion in certain areas during the same time?
Yeah, so that's speaking to one of the previous questions, right? So how we know it's now the anti-abortion ban in general rather than this specific ban. I think two results really help us here. The first one is we actually found 2 states, they don't have other anti-abortion bans happening around the same time as the sex-selective abortion ban. And then we use that as a treatment group, but we still find effects. And then second, if it's more generally about anti-abortion bans, we should expect to see effects among, let's say, Black Americans or Hispanic immigrants, other vulnerable groups, but we don't see any effects in any of the other groups in our analysis. So suggesting that it's not, so we already removed, at least model superstition already removed the effects of the more general anti-abortion bans. Any other questions? Yeah.
So I have a question about the heterogeneity effect by education groups. If you can show the slide.
Yeah.
I think it seems like the protective effect for the women with less than average.
Yeah, so I think the results here for the preterm birth is a little messy. I think I wouldn't interpret too much about the p-value. Here is on the S. So we basically didn't find adverse effects among less educated group, suggesting that again the material or resource deprivation may not be the mechanism here, because if that's the mechanism, then that would harm the less educated group more. But here we actually say it's the highly educated group who are more affected, suggesting that it's really the symbolic exclusion, the highly educated group, they are thinking about their racial identity more. They are more aware of this, they are more aware of the discrimination happening in this state. Thank you. Any other question? Yeah.
The evidence of public awareness. That's the state media reports.
Yeah, so we do, that's a great question. So we do have, we do find many media reports and I know like Asian American nonprofits and advocacy groups in the States, they are trying to really abolishing these bans. So there have been some media exposure, but I mean, honestly, there's so many anti-abortion bans going on. I don't think, you know, people's awareness is that huge. But here, the mechanism is more about social climate, we argue that it's not actually necessary for Asian immigrants themselves to be aware of such bans. So they may be aware of such bans and the narratives, in which case they will be directly affected. But if they're not aware of such bans, but their colleagues are aware of such bans, and then they would act differently surrounding them, right? So their feeling about social climate getting worse towards them. I think that's the most important channel here in terms of affecting them. Yes.
Thinking about duration in the States, how long the person's been exposed to the problem. Is there differences?
Yeah, that's a great question. So unfortunately, we don't have when they came to the States. So the birth data is birth certificate data is great, but the number of variables is a little bit limited in this regard. Any other questions?
More questions? All right, well, thank you again, Alma.
Thank you.
And next week, please join us for another SBS back in room 1208. So right above us, like last week, if you were here, for Dennis Behan, Assistant Professor of Demography at University of California, Berkeley. He will be presenting on validating social networks-based estimates of adult mortality with high-quality vital records, evidence from 27 cities. The details to register are on our website. Thank you.